This case was one of the most challenging cases of my career. Baby of Sumalatha, who was referred to us from Anantpur. What is special about this baby? The baby was born in RDT hospital in Anantpur, and the reason for delivering this baby was because they thought the baby's heart was racing very high. And when the baby was delivered, they also noticed that the heart rate of the baby was around 250 to 280, because if your heart is beating that fast for a longer period of time, then your heart tends to fail. So this baby was referred to Hridaya hospital in Anantpur from RDT hospital for a better care. And there they tried to give a dose of adenosine. This is a lifesaver drug and a drug of choice to treat babies who've got really high heart rate, especially a condition which is called SVT, which is Supraventricular Tachycardia.
Usually SVT in newborns are very rare. It's a very rare. Congenital SVT is very rare. We get it SVT, but some electrolyte imbalances and some conduction defects or some sepsis can cause SVT, but even that is very rare. I think I have seen 2-3 cases of SVT in newborns. Okay, pediatric we see some cases. And the line of treatment is adenosine, and which is given at RDT. That come to Hridaya hospital for the further treatment.
So after giving the drug, usually the heart rate will come back to normal. However, it did not happen in our baby's case.
But the heart rate is already too high, and already injection adenosine was given. So the next line of treatment is very complicated. That needs some cardiac monitoring and cardiologist opinions, all this, which is not possible at Anantpur. So we shifted the child to Motherhood Hospital.
Our ambulance set off within 15 to 20 minutes after receiving the phone call. The baby was met at Chikbalapur, which is almost like halfway through from Bangalore to Anantpur. And instead of just bringing the baby to the hospital straight away, we parked our ambulance in a safe place and then started giving adenosine medications under control. In spite of giving 3 doses of adenosine, the baby did not respond. So in spite of doing this, the baby's heart rate did not come back to normal. Therefore, the baby was put on oxygen and then safely transferred back to the hospital, where we have more resources in terms of looking after the baby. We are so confident with our ambulance transfers, and we call that as NICU on the wheels, because we can do majority of the things that can be done in the NICU itself. We started establishing this condition.
రోజు మాకి పొద్దున 10 గంటలకి కౌన్సిలింగ్ చేసేవాడు సారు, మీ బేబీ కండిషన్ ఎట్లుంది అని. మన సారు బాగా చేసి 3 రాష్ట్రాల వాళ్ళు వేరే దేశం వాళ్ళకి కూడా పిలిచి మీ బేబీకి ట్రీట్మెంట్ చేపిస్తుండన్నాయా.
We made sure the echocardiography is done immediately and made sure the structure of the heart is all right, and then we did a lot of continuous ECG monitoring to understand the type of rhythm that we are dealing with, to make sure our diagnosis of SVT is actually the correct diagnosis. Involved the cardiologist and the cardiothoracic team and discussed quite a lot about the case. So almost 24 hours passed by and we were not getting any response in terms of the rhythm getting better. However, because the baby was stable, we could maintain this. By second day, we started noticing that the baby's heart was tiring. Then we did a lot of research and tried and find out any other method of treating this sort of condition. Anecdotally, we came across total body cooling as one of the therapies that could be used to reduce the heart rate and bring the baby's heart rhythm to a normal rhythm called a sinus rhythm. We were dealing with a very resistant SVT, resistant to almost 4 drugs and on continuous infusion, resistant to shock as well, and we were left with almost nothing to do. So therefore, total body cooling, upon discussion with the family, was instituted on this baby. This is a therapy where we put the jacket and then the servo-controlled machines are there that will help in reducing the body temperature to 33.5 degrees. And this, we will maintain it until the baby's rhythm gets back to normal. By God's grace, it started working after about 6 hours of starting the total body cooling. And then the heart rate gradually started coming down to about 200, 180. I think we all had a sense of relief, and then it started coming back to about 130, 140. So coming back to the normal rhythm was a triumph in itself. This family belonged to a Lombardy community, and they came all the way from Kadri, which is even about 100 kilometers away from Anantpur. This is a very remote area, and the sense of relief, the sense of achievement we realized after understanding where they've come from. And the best part of all this is making sure that these sort of high-end therapies are available to babies even coming as remote as from Kadri, which is about 300 kilometers from Bangalore. So I'm very grateful to Dr. Srinivas to basically make sure that the baby is referred at the right time, and obviously the rest which followed was a history. So Dr. Srinivas helped us getting the baby back to his hospital.
And baby kept here for another 2-3 days for just monitoring and heart rate monitoring again. And the parents were taught at the home how to monitor with given a simple pulse oximeter.
Our team, which is absolutely fantastic, to carry out these sort of tasks, with a lot of belief and with the sole idea that it is going to help the baby.
And thanks to Dr. Prathap and his team of neonatologists at Motherhood Hospitals, done an excellent job.
ప్రతాప్ చంద్ర సార్కి మా జీవితం ఉండే వరకు, మా పాప మా బేబీ బతికుండే వరకు రుణపడి ఉంటాం.
And I'm really happy now this baby girl is almost 4 months of age and is a bundle of happiness.